The preparation stage is where we develop a plan for overcoming the problem. The book talks about the 3 pillars of recovery, which are 3 of the most common components you'll find in a good recovery plan. So the first part we're going to talk about is the professional care piece, in other words, treatment. This will typically start out at an intensive level of care and then go through a series of stepping down into lower levels of care as the client progresses through the treatment process. So inpatient hospitalization or residential treatment are going to be your most intensive levels of care. And there's a section in the book that talks about the criteria for determining who goes where. Some people can start directly in outpatient treatment. Others need to start in residential. So if you start in residential, that's typically going to last anywhere from 1 to 3 months. Then they'd step down to intensive outpatient treatment, which is usually another 1 to 2 months. And then ideally they'll continue in some kind of structured aftercare program or outpatient counseling for another 6 to 12 months. So you can see that from start to finish, a client's involvement with professional care should last from 12 to 18 months. Sometimes I'll say, sort of joking, that when a client's signing into residential treatment and they ask how long it's going to last, I wish they'd tell them right there 12 to 18 months. And the client would be like, no way, I'm out of here. But then they'd say, no, calm down. You're not going to be here for 18 months. But if you're going to do this right, you need to know that a year from now, you're still going to be involved with some sort of professional care. Now, that last 6 to 12 months might not be anything more than a monthly potluck alumni dinner at your treatment center where you happen to see your old counselor and visit for a little while. But the point is you're still connected to your treatment, because the relationship you have with those people is different. Even with minimal contact, there's still a level of professional accountability that you just don't get out there at your AA or NA meetings. Now, from a stages of change perspective, for the client who starts in residential, ideally we'd get the contemplation and the preparation stages nailed down solid during that time. They should have no doubt about the nature of their problem, and they should have a good understanding and commitment to a plan that's been developed for going forward. So when a client's getting ready to move, say, from residential treatment to IOP, it's a good idea to take a measurement of where the client is. Are they accepting that their drug use is a problem? If so, are they clear about what that means? As in, do they understand that recovery doesn't mean just quitting hard drugs and continuing to smoke pot? Are they committed to a good relapse prevention plan? Or are they still arguing about some of the things that are being recommended? Now, it's important to note that none of this stages of change stuff, the way we're presenting it here, is set in stone, and in particular, how it lines up with this continuum of care. There's always going to be some movement back and forth depending on how you look at it. For example, making a plan to go to treatment would be considered preparation stage work. It's part of the plan. But then when they get to treatment, they might start doing some contemplation work, or attending treatment groups and doing assignments would clearly be new behaviors, which could be considered action stage behavior. So there's definitely different perspectives of how you can view this. The important thing here is being aware of where they're at and treating them accordingly. If they're still shaky in their contemplation or their preparation, but they can't stay in residential treatment forever, that's okay as long as you identify where they're at and just continue from that point as they transition into their next level of care. So from this continuum of care perspective, they obviously need to be clear in their understanding of why they need to continue in professional treatment once they leave the first phase of their care. And saying it that way, first phase of their care is an important point. When a client starts out, especially if they start out in residential treatment, the first thing they need to understand is that discharge doesn't mean that treatment's over. It's just a transition to the next level of care. And in a lot of ways, you could say that this is where the real work is just beginning. And that's what we're going to talk about in the next video.